So as usual, we've got our Director of Public Health, Anna Hartley, who is going to talk us through the data.
Thanks, Tracy. Yeah, so as you can see, we had that with it. You can see that we've had that massive drop in cases. And then I think we had over 700 per 100,000 cases, and that's dropped right down now to sort of, well, it's halved basically. But what we have now seen is a levelling off. So if I just show you the next slide. So this is the sort of hot off the press data that I've just received this morning, and what you can see is you've got your local authority areas down the left hand side with Yorkshire and England at the bottom. And you can see that if you look at Wakefield, which is third or fourth from the bottom, you can see that we've been around 360 for a whole week now. So we've seen a bit of up and down, but no real reduction. And actually that's not dissimilar to quite a few other local authority areas. In fact, what you have seen is some areas starting to sort of creep up a bit. So I think we had like the Euro, where we had the Euros, we had a big jump because lots and lots of people were mixing, and also I think all the work that Jenny did around door knocking, 20,000 door knocks and all that extra testing really pushed those figures up, and now those are coming down, and quite a lot of that we think is a genuine finding. It's not just people not getting tested, it is genuinely that we have seen a reduction, and that would be backed up by our admissions data and our death data, which I'll show you later. But obviously the concern is that if we're plateauing at this level, it's still a very, very high level to plateau. So actually, Tracy, if we go back to the previous slide, so if you look at kind of where we're plateauing, it's actually much, much higher than where we were this time a year ago. Let's see what that is. Yeah, that's that. But also it's too high basically. So positivity is looking, the positivity has reduced, which is again showing you that we probably are testing enough people. Obviously we'd like to get that well below 5% again, but at the moment and you can see it's just started to go up again. And then positivity by age group, so again this gives us a bit of a sense of where we're at. So if you look at that, I think it's the 11 to 16 line, which is that greenish sort of greeny line at the top, you can see that unbelievably over 50% of those tests that are sent off come back positive. So that's really an indicator of how we're still seeing extremely high rates within that group. So whereas our kind of lower, I think our 80 pluses, it is a very low percentage that test positive, so indicating that we are getting enough, we're doing enough testing in that age group. Something around that as well is that care home residents are getting tested a lot more. So if there's a couple of positive cases in a care home, often the whole care home's PCR tested. So that's potentially again why that number's quite low. So just having a little look at our age specific testing rates. So again, you can see that that our younger age groups remain sort of the highest rates that we're testing. That is, but you can see that nearly, well, all age groups really, apart from 80 pluses, have come down. And again, 80 pluses, they probably are a bit different because there's probably a high proportion of those are within care homes, so they will be getting tested more on an ongoing basis. So the slide of doom is not as bad as it was, but you can see that although those numbers have gone down a lot, so you can see within that 17 to 18 age group at the beginning of July, we had a rate of 2,139 per 100,000. That's gone down to 789. But again, you can see that's slowing, that's plateauing way higher than we'd want it to be. And also within that 80 plus age group, those rates are still too high. So you'll remember that for quite a while those were at naught. And also the 60 to 79 age group. So those are areas that if people do contract COVID at those ages, it is a lot more worrying or have poor outcomes. So it is, given that the reason why they went back to dropped all restrictions at this time of year was because traditionally in the summer there's less infection spread. Our cases are low, so they were very low last August. So given that, it is worrying that those rates are sort of remaining kind of stubbornly high, particularly amongst our younger age group. So again, just to show you that across the district, the rates are fairly well spread out. Again, no particular hotspots there. So this was a really interesting slide that the health intelligence team pulled together, and this is really to look at what you might want to call long COVID. So that's like a syndrome. So there's no specific definition. It's a syndrome. There'll be lots of different symptoms within that, but it's defined as people who experience symptoms of COVID post I think it's 12 weeks after becoming infected. And what you can see is that because our rates are so much higher, we will also have greater numbers of people who are experiencing those symptoms 3 months or further, and particularly in July we estimate that will be 1,173 people. And if you look at the table at the left, which has got your age range down the left hand side and then your percentage estimates within that population that will develop long COVID, you can see that is, you know, that those are quite high percentages still. So 7.44% of 2 to 11-year-olds. So potentially that's going to have quite a big impact on local residents, also on services who may have to pick up some of the ongoing sort of care if people have particularly extreme levels. And then admissions, so again you can see those have gone up. They've not gone, they've sort of stayed fairly steady, but the hospital, I was just hearing this morning, hospital is under a lot of pressure. Apparently I think there were 200 people in A&E yesterday evening, so it's under huge pressure, not because of COVID, but probably because a lot of kind of stuff that hasn't been dealt with during COVID that's now kind of coming to light. But again, this is a good slide to demonstrate, as I say every week, the power of vaccination, because there's nothing like the hospital admissions that we would have seen if we didn't have the vaccination campaign, and hopefully that will settle that number as our numbers as our infection rates have sort of steadied and leveled. So again, just to show you, just to finish off with deaths, and you can see we've had a couple more deaths, which I think I said last week we were expecting those deaths to go on. Sometimes it just takes a while to get them registered, but again, not seeing anything like the rate of death that we would have been seeing previously with the infection rates being so high. And I think we're going to see a few more deaths over the next few weeks, given our the amount of people that are in hospital. I think that's the last slide, Tracy. Oh no, sorry, just one on vaccination progress. Again, you know, this is a very positive slide. So over 2,000 people in the district have had 2 vaccines now, which is really, really impressive of those that are eligible. So 70%. So again, you know, that would be, if there was any other campaign, we'd be jumping for joy. Obviously, given that our infection rates, we still need to get those numbers up. But we're hearing that people are still coming forward for vaccination, and actually our young people are coming forward for vaccination. So that's really, really good. And actually those numbers are looking pretty positive. They're sort of creeping up little bit by little bit. They're creeping up. So you can see with the 45 to 49 age group, it's gone up 0.2%. And the same with the 40 to 40 year age group. But it's kind of that thing about just keeping on chipping away until we cover a far more population. Oh, that's it. So just to say as well, we are still seeing that patterning of inequality with vaccination. So areas with lower inequality, we're seeing far higher rates of vaccine. So again, just sort of be mindful of that. I think that's it from me.
Thank you, Anna. Does anyone have any questions for Anna? I don't know if any of my colleagues can see if there's anything in the chat. That's great, thank you very much. You might have noticed that usually we send out an infographic which just shows how many people have been getting the vaccine. The infographics are no longer being done at present, but if people are interested, the latest data can be found on NHS England, and there's the website for it. And we've just put a few slides together. This has been taken from the CCG's webpage of where you can get a vaccination in the coming days from Lupsa, Airedale, Navigation Walk, Castleford, St Swithun's, Sandal Rugby Club and Wakefield Morrison's. The information is all there for you. I'll let you read that at your leisure when you get your slides. Andrew, I don't know if you want to say a few words about this campaign.
Yeah, absolutely. Hi everybody. We changed the campaign slightly a couple of weeks ago. You may remember that the previous campaign was Let's Keep Going, but since we moved into the latest stage 4 of the roadmap, we changed it to Let's Keep Life Moving. with the sort of sub messages of be careful, be kind, be safe. So we're pushing out this campaign across the district using things like display boards in shopping centres, social media, press releases. We're going to be starting doing some information stands across the district. So really just encouraging people that whilst Freedom Day has come, or what's dubbed as Freedom Day, the danger still remains, and urging people to be cautious and doing what they can to protect not just themselves but all those around them. So lots of communications sort of still going on at the moment. Happy to answer any questions.
Thank you, Andrew. Does anyone have any questions for Andrew from our communications team? Thank you. I'm not sure if this is one for you, Andrew, as well. Is this?
Yeah, so it is. Yeah, Summer Loving campaign is another campaign the Megan in the comms team is leading on, and that's very much welcoming people back into the district, encouraging them to come back and sort of enjoy the summer. And there's a couple of competitions going on, and that's encouraging people to sort of talk about what they like during the summer, what they like to do, and the younger people can take part in a drawing or painting competition. So all the details are there, and the Summer Loving campaign is being backed up by radio commercials on Rhubarb Radio, which are talking about encouraging people to come back into the district and encourage them to enter the competition. So just sort of keeping people motivated and giving them stuff to do over the summer holidays.
That's great. Thank you very much.
Yeah, we at Young People's Empowerment Project, we've been doing some work with young people around the vaccine, and I'll just hold this up if people can see it. That's some of the work that young people have been doing to promote the vaccine. So okay. I don't know if we can share that with you so that you can try and help us to promote it.
Absolutely, yeah. If you want to send through anything yeah. You've got, I'll happily incorporate it into our communications campaign and share anything you have.
Okay.
Are you able to take photographs of them to send in?
Yeah, I will scan them and then try and send them in an email.
That's brilliant. Thank you very much.
That sounds really positive, really good, yeah.
All right, thank you.
Thank you. And there's just a few resources that I was sent earlier in the week. We've got a leaflet, which is If Your Child is Poorly leaflet, available on our website, and it's really good. I've had a quick look at it this morning, and it's the usual coughs and colds and fevers and things like that, but it's really useful information on there. The West Yorkshire and Harrogate Health and Care Partnership are also launching a violent reduction anti-racist movement. So there's information on their website and a link for that, anti-racism. And then the West Yorkshire Health and Care are seeing a lot of more people coming in with care needs. So they've put some information on their website, and that's also a really useful website. So the links are there for you to go and have a look at your leisure. We've also been asked to promote from Livewell Wakefield that they're offering some workshops around long COVID, and Anna's just explained, hasn't she, that that's something that we need to be mindful of. So they've got a couple of things: managing fatigue with long COVID and managing breathlessness as well. The 6-week courses, referral by telephone, email or via the website. And there's a link for Livewell Wakefield on the slides. So if you know of anybody that might need to have that, please do help to share that information. And just to let you know that because it's August and a lot of us are away on holiday, we have cancelled a couple of meetings, but the next ones will be the 25th of August and the 8th of September. And the Zoom link is there for you as well.